Good afternoon, everyone. Thank you to the Confederation of Mental Health Network for the saving lives. It's a really important message. I want to talk you through my own organisation's pursuit of zero suicide in healthcare, and as a founding member of the Zero Suicide Alliance, to tell you a little bit more about that as well. We got into this because of one big, profound set of events a number of years ago in the Trust, when 3 people died in one unit in our care, which in itself is a terrible tragedy. And I went to visit the family of one of the young men who died, and I met his mother, and to feel that that person's hatred focused on me, but for my organisation, because in truth she had offered her son to the organisation to keep him safe, and he died in our care. So that was a moment, a watershed moment for the organisation, for me personally, when we knew we had to do something fundamentally different. Then also, just about the same time, I saw this graphic, which for me is just an astonishing set of trends. If you look at global trends in avoidable death, and you look at everything that changes there, yet suicide remains static. That's 2009 to 2012, but we can extrapolate that curve out to 2019, and globally the number of deaths are going up. 1 person every 40 seconds globally dies by suicide. So it intrigued me why that was the case, and I think I also thought about some other, I think, important informers of expectation. You know, if you think about it, smallpox was eradicated in 1980. If you think about cancer survival here between 1975 and 2007, dramatic changes in cancer survival. Polio almost eradicated globally. And this year, the AIDS, UN AIDS 1990 target met in England for the first time. So most people now with no viral load. And it makes me think, what is it that allows some conditions to begin to be eradicated or dramatically managed, yet you look at the suicide figures globally and they go up. And in this country, as Ruth said, they come down. We're making progress in this country, but it is still stubbornly resistant. So you can choose whatever figures you want, but 550 football teams a year equivalent die by suicide in this country. There's something that's not happening that should be happening. What makes a difference? We could debate this for a very, very long time, but progress because of political support. So it's tremendous that we now see political support for suicide prevention, and indeed the Prime Minister's announcement that all NHS staff would be encouraged to do our suicide prevention awareness training is a big move forward. Activism is tremendously important, and you've heard Steve speak eloquently as an activist, and there are thousands of voices like that are beginning to coalesce, but we need more funding, we need more research. Mental health research, suicide research is a small component of what we spend on healthcare research in this country. Working at scale, which we haven't done, and insight to improvement. We can have as much knowledge as we want. Steve and I had a conversation earlier. We can have as much knowledge as we want, but you want us to do something with it, you know? And it's inhibited by stigma and lack of hope. I remember the AIDS adverts, the HIV AIDS adverts of the 1980s with the falling tombstones and graves. Think about where we've come now with the UN 1990. And that's been about reducing stigma because we created hope beyond desperation. And I think that's our core target in many respects for what we need to do in terms of suicide prevention. But this for us became our core mantra then. If the number of people who should die by suicide isn't 0, what then is the right number? And then who's going to choose which ones? So actually, you know, it's a question that has only got one answer, as far as I'm concerned. It has to be zero. Zero is not zero tolerance. This is not about berating caring professionals because something happens on their shift. It's not about identifying bad organisations. It's not about pointing the finger at people who attempt suicide, who should know better. It's not about no tolerance. It's not a target either. In my trust, we've never set a single trajectory for this. Zero-based thinking is about breaking away from tradition. It's about new aspiration, seeking new horizons, doing different things. And actually, this is a global movement now. We're part of that through the Zero Suicide Alliance. The Rotterdam Declaration states quite simply that we foster a safety-orientated culture committed to dramatically reducing suicide among people under care, and a just culture that avoids blame, ensuring professionals perform at their peak and everyone learns from adverse events and near misses. So our response to this in England has been the Zero Suicide Alliance. It's very focused on the concept of knowledge into action. So again, to go back, I've been so impressed with the way Steve phrased in his presentation the need to do something. And actually in this country, we're blessed with the best suicide prevention information, I would argue, in the world, but we need to do more to move it into action. So we're not very old in this alliance. It is an alliance, it's a social movement. I hope it's a social movement that will join close to the other social movements very soon to create something special. Over 300 organizations, turned into 350 yesterday because of this event. We attracted 50 new organizations. We've done a little simple training tool, which I'll talk about in a second, but we set ourselves rather randomly the target of training 1 million people to be able to have a conversation. It really surprises me how quickly we've reached 200,000. And the Prime Minister's request of every NHS organisation to try and have this right throughout our staff and services might make us reach that million. Now, what does that mean? What it means is we've got 1 million people who will go home at night into their communities, probably talk about it, maybe collectively we'll get another 1 million people. And that means we've got a movement, a wave of protecting our friends, our families, our workforce, everywhere we turn. So we can't underestimate absolutely the importance of this. Then in our own organisation, we made a clear statement: suicide is an avoidable death. It is preventable up to the very last second by wider public health interventions, as Ruth said, but it's also amenable to high-quality evidence-based interventions for those in our care. So about 1/3 of people are known to the NHS who die by suicide. So if we know them, surely we can do more to close the gaps, and therefore this is really an amenable group that we can get to. So our focus has been pretty simple: better processes. So let's close the gaps, let's put the evidence that we have into action and make it systematic. And then secondly, produce a better culture around it. And that's about 2 things. It's about a just and learning culture so that people, our staff, are free and able to learn. And it's about inside our staff groups, that thing again that Steve mentioned about compassion. So if Steve had gone to a GP premises and said he had central chest pain, everything would have stopped, an ambulance would have been called, and you would have been in services instantly. And that's actually writ in our compassion inside the DNA of the NHS to respond in that way. Yet we don't see people who are suicidal in the same way, and we've got to change the pace and temper with which we do things. Mersey Care then, our response has been very simple. 4 cornerstones and 10 practices for zero suicide. And there's a lot that we could talk about in that, but it won't happen today. But the one thing I do want to point out is the co-production with service users, very top, of materials and resources for self-care. And that has, one of the first products of that has become our Zero Suicide Alliance training. And it's very, very simple. It says, see, say, signpost. Recognize why a person may be at risk of suicide and identify some of the key signs. Talk to someone if you're concerned and ask directly if they're thinking about suicide, and then help them to get to the right place. And the middle bit is really important. It's a myth buster. Often we believe if we talk to people about their suicide, it will provoke them to complete that suicide. Actually, all of the evidence points in the opposite direction. One of the most preventative things we can do, as Ruth said, is a simple conversation. Listen with compassion and care, and then signpost. So the training doesn't turn you into a suicide prevention expert. What it does is give you the basic tools. It's very simple. It takes 20 minutes to do. And here's the impact in my organization. We ask before and after, is suicide a selfish act and is suicide inevitable? 80% of people, 80% of non-professionals thought suicide was selfish. After the training, that goes down to 10%. Is it inevitable? 60% of our corporate staff thought it was. Amazingly, over 50% of our professionals thought suicide was inevitable. That reduces to 10% after the training. But let me ask you a simple question. If you think something is inevitable, how are you going to go about preventing it? We simply have to convert the inevitability question into the prevention action. And this training, 20 minutes, reduces that, both of those issues, which are the root and source of stigma, to 10%. This is hugely enabling. And then adjust and learning culture. We must not blame clinicians, families, staff in this. We have to have an open, balanced, just and fair culture. We've done a huge amount on this in our organisation, and the Alliance will soon produce a tool for boards to work with to make sure that every organisation creates a psychologically safe environment for patients and staff to talk about what needs to happen to create the change that will deliver really great prevention. So does it actually matter? This is the Trust's rolling three-year average for the suicide rate per 100,000 population. And what we see since we started, which there's a little arrow where we started this work, we've seen a 30% reduction in 3 years in deaths by suicide for our patients. That's not just inpatients, that's patients of Mersey care in every setting. And I show it really because it's important, I think, that as we talk about this, we demonstrate efficacy. We demonstrate that we can do this. 10% a year is a dramatic reduction. And now what we need to do through collective endeavour is look for our tipping points where we can actually go much further. There's lots of contact information there for you afterwards. The stalls outside, please sign up. Thank you.